Pleased to welcome you to today's event. I want to thank the New Hampshire Nurses Association for organizing this event this afternoon. And I will be your moderator for today. We're convened to hear from our nursing, healthcare, and community colleagues who will be speaking out in support of providing Medicaid to over 50,000 New Hampshire residents. This support comes with the hopes of urging New Hampshire legislators to move forward with Medicaid expansion in the state and avoid a delay in health benefits.
That the House and the Senate will use the Commission's findings as they develop a New Hampshire solution for providing health care coverage to all our citizens in the next special session of the legislature. We support increased coverage to improve access to mental health care and substance abuse treatment. We need to sustain community-based mental health delivery system.
Really, the expansion of Medicaid is going to serve 58,000 Granite Staters with the option for insurance. Most individuals without insurance delay treatment, and they wait, like Maggie said, until they're at the death's door and they show up in the ER. And so then we give them care at the highest cost, way too late.
So now her asthma turns into bronchitis, which now turns into pneumonia, and she comes in once again. Here she is, she can't breathe. She's like, they rush in, we're giving her aerosol treatments, all kind of steroids. It costs so much money. If she would have just went to the doctors preventive, she could have had an inhaler, and she would have had education and said, this is what you have to do. Take your inhaler, take your medication, and it'll keep you from getting sick.
One of the individuals had said, big government doesn't work, programs don't work, why are we moving in this direction? Well, I am with a program called Drug Court, Grafton County Drug Court, and I'm with the Friends of Grafton County Drug Court, and the program works.
I know that New Hampshire can't fix the national health care problem, but what we can do is take advantage of those federal dollars that are coming our way, expand Medicaid, and not only do we save money in terms of the direct care that we provide patients, but also the loss of productivity that patient faces, who's lost his job because he couldn't get treatment. And now that family's going to end up needing some kind of social support system as well.
But I would rather have somebody waiting in line and saying yes to treatment than somebody walking away and losing their life, their family, or their home.
Yes, having people with more coverage may put a strain on the system, but at the same time, those same people are costing the system, only they're not reimbursed. So we see layoffs in hospitals and crisis care, as you said.
People with no insurance coverage tend to access the system in the most expensive way, through the emergency rooms and the emergency departments of our mental health centers. They are falling between the cracks, and the cracks that they fall into are life-threatening.
A client who had graduated 3 years ago had called our case manager, Jennifer Stone. And in the conversation, he said, I don't know where to turn. You are people who help me. I need assistance. I can't afford for my medication. He was diagnosed with bipolar, and he stopped taking his medication. He came to us for assistance. This is an individual who fell through the cracks. This is the kind of person who would be saved through the expansion of the Medicaid expansion program.
Every human being has the fundamental right to access to quality health care.
And then if she does get sick, she can go to a provider and say, I'm getting a little sick, and he'll increase her medications or give her another dose so she doesn't come to the emergency room where it now just costs a lot more money to take care of a crisis instead of taking care of preventive.
What we do is accomplish the mission of Drug Court by improving community safety, decreasing financial costs incurred by criminal justice system, and assisting nonviolent substance abuse offenders in breaking the cycle of crime and drug and alcohol addiction. It's an 18 to 24-month drug and alcohol rehab facility that has intense treatment and intense supervision.
I cannot imagine a greater sense of distress than having a sick kid at home and not being able to make that choice to go for treatment.
This is just a list of some of the accomplishments some of our participants have had since the program started in 2007. 5 drug-free babies born in the program, and you nurses know what that means. Drug-free babies born into a program that is a drug and alcohol rehabilitation program, saves dollars. 8 clients regained custody of their children and had their parental rights reinstated. 10 clients regained their driving privileges. 1 client was reinstated in his senior year at college. 8 clients have enrolled in college. 3 clients had started their own business. 3 clients have completed their GEDs. 2 clients gained career opportunities due to their felonies being expunged from their record. That's the big carrot in the program. If you are successful in the program, your felony that you were charged with is expunged. Another thing, when you're in court, you hear the judge say, or you hear the bailiff say, "All rise." We all rise when lives are saved. We all rise when families are reunited. We all arise when drug and alcohol addiction is abated. Support the expansion program. Thank you.